Hey there, I'm Dr. Jeremiah Sample from Family First Chiropractic. And I'm here today to talk to you about 3 common causes for hip pain. Now, of these 3 common causes, understand that there may be a few other reasons, but for about 95% of the population, according to studies shown, this is why it happens. First one I'm going to cover is what we call tendinitis. All right? With tendinitis, it's where the muscles attached to the bone become strained or stretched and then inflamed, causing pain at the attachment here at the hip. When I'm talking about hip pain, this is what I mean, right where the femur head attaches to the pelvis, okay? Now, tendinitis tends to form with people who are long distance runners, dancers, ballet, which here in Omaha, frequently show choir, okay? Also, in older people that maybe are slower moving or their joints aren't as strong as they used to be, okay? The second type that I'm gonna cover today is what we call bursitis. Now, a Bursa sac, which is the cause of the bursitis, is a small fluid-filled sac that is meant to be between a muscle and a joint that helps lubricate the joint and provide ease of movement. Now, if it's overused, what happens is it becomes inflamed. Depending on where it's at, there's generally 3 types. One being they call trochanteric, which would be on the side of your hip, right? Or it could be the iliopsoas, where it be in the front, kind of as your leg moves in. Or another one, the glute medius bursa, which we know where that's at, all right? And finally, I'm gonna cover the most general term that we hear, sciatica. Now, sciatica basically covers anything from this region to this region, and what makes up the largest nerve in the body, the sciatic nerve. Now, the reason for sciatica, because it involves so many structures that we feel down the leg, and it can be anything from the lumbar spine to the sacrum to the SI joints, is usually due to pelvic instability, or we find a subluxation, meaning your pelvis is shifted, and now your gait has changed, and we're putting more stress on one side as compared to the other. This increases inflammation and makes it more difficult to walk, and starts that radiating pain that can go either from the low of the back, down to the foot, even to the toes. If you have more questions about what might be causing your hip pain, or that of a loved one, please comment below and we'll reach out to you.